So this is just a continuation of what I was talking about in my live streamings before. This is the third live streaming today, and so my reminder and my warning to my colleagues and my students is, in order to avoid the drug interactions or to minimize the incidence of drug interactions happening in clinical practice, is to study well and understand the what we call the art of drug prescribing. The art of drug prescribing, because drug prescribing by a physician, because drugs is the weapon of the physician, exactly like the scalpel, which is the weapon of the surgeon to carry on operations or operative procedures on patients in surgical treatments. Also, in medical treatments, drugs and different types of medications is the weapon of the physician to manage and to save the life of the patient. So the patient should understand the efficacy, should understand the beneficial effects of the drugs, and also more important to understand the safety of the medication or the potential dangers which might arise from the medication he or she is writing or prescribing for his patients or his consumer. So we have to remember that every medication has a risk or has problems or has side effects or maybe adverse effects which are more serious than the side effects, or maybe also sometimes lethal on the body and producing other problems, what we call iatrogenic effects of medications or iatrogenic diseases. So we have to remember, as much as we remember the efficacy, we should remember and beware more of the side effects and adverse effects and the lethal effects of the medications used, and this is what we call the safety of the medications. We should understand the safety of the medications. We should understand the tolerability of the medications. We should understand the efficacy of the medications, because this is related to the issue of drug-drug interactions. So the art of drug prescribing, if the physicians study it well, what is the art of drug prescribing, how they prescribe drugs, they should minimize or avoid the instance of drug-drug interactions or drug-food interactions or drug-condition interactions, and this is the basis of minimizing or avoiding or decreasing the incidence of drug interactions in clinical practice, and decrease the incidence of medical mistakes arising from drug interactions, which need the physician to be aware, need the pharmacist to be aware, need the nurse to be aware, because she is doing the and executing and carrying the medical orders given by the physician in the ward or in the emergency room. They have to understand the art of drug prescribing in order to avoid drug-drug interactions or drug interactions in general, especially that I mentioned that drugs they might cause also what we call drug-induced diseases, like drug-induced gut disease, drug-induced blood disease, drug-induced pulmonary disease, drug-induced heart disease, drug-induced neurological disease, drug-induced connective tissue disease, drug-induced rheumatic disorders, drug-induced neurological disorders, drug-induced immune disorders. So drugs might disturb the body, drugs might cause iatrogenic problems. So because of the potentiality of the toxicity of the drugs and the side effects of the drugs on which we give them for some medical conditions or diseases on other organs or on other systems. They might endanger other organ or systems, so we should be aware of this in order to decrease such drug-related organ dysfunction and in order to avoid the issue of drug interactions. And in order to reach to such targets, avoiding drug-induced diseases and avoiding drug interactions, we should understand the drugs, and we should learn and understand properly the art of drug prescribing. Before you combine 2 or 3 drugs, think together whether these 2 drugs are okay to be prescribed together, or there will be some sort of interaction between these 2 or more drugs when they are given or prescribed together to the same patient on the same prescription. This is especially true in patients with chronic medical diseases, with 2 or more diseases like diabetics and hypertensives, and with chronic at the same time with chronic complications affecting the cardiovascular system or the kidney or the liver or the brain. So we are giving them, of course, 3 or more medications, and here there will be drug interactions, and I have to think, is there any potential interaction between the anti-diabetic and the anti-hypertensive and the lipid-lowering drugs which are given together? And when I prescribe, for example, an anticoagulant to that patient due to a complication like cerebrovascular stroke or unstable coronary syndrome or acute coronary syndrome, and so I have to write anticoagulant, or the patient developed atrial fibrillation and I have to write anticoagulant or antiarrhythmic. So the patient will have antiarrhythmic and will have anticoagulant in addition to the antidiabetic and the antihypertensive. So here comes the issue of the certain drug interactions, and I have to think, and the physician has to think before he write additional medications due to deterioration of the chronic condition or acute deterioration of the chronic condition or progress of the chronic condition or another comorbid condition or another acute event like infection complicating a diabetic patient or pneumonia or others. When I write the antibiotics, will there be an interaction with the basic medications given, the antidiabetic, the antihypertensive, whether this antibacterial drug will have interaction with the other basic medications given to that patient, or that antifungal drug given to that patient to treat the fungal infections or to treat the acute pneumonia or the septicemia, will have interaction with the basic medications the patient is already receiving for diabetes, for hypertension, or for chronic renal disease, for example, or not. All these things should, the physician should think about it when he is or she is prescribing 3 or more drugs to manage 2 or more medical conditions or pathologies in the same patients, whether they are chronic or acute and chronic conditions happening in the same individual or patient. Thank you so much. And this is all very important in order to decrease medical mistakes, because medical mistakes due to drug interactions is the commonest medical mistakes done in clinical practice. And all healthcare share in these mistakes, including the physicians, the surgeons, the nurses, the pharmacists, all. So all should understand the art of drug prescribing and study well drug interactions. Thank you so much.